Okay, we're going to go through a couple things on the Chapter 6 coding practice. Okay, so the first question, it's going to ask you there are two CM codes that you will use. Notice here that the the diagnosis was acute sinusitis, and the patient continues to smoke. So the doctor is saying that she's a smoker. So just a hint, two diagnosis that you would be putting in. So I'm going to go ahead and save this answer and go to the next question. Okay, question two. Sorry, this is actually asking you for the second code of this. So it would, again, remember acute sinusitis and the patient is continuing to smoke. The third thing is asking you what is the CPT code. The good thing about this assignment that I noticed is it actually tells you, is this an established patient or an initial, so that should make it a little bit easier. But as I was going through this, I want to point out a couple things that you can kind of look at, whether you have a cheat sheet or you're using 3M or however you're doing it. But just notice that the patient is right here. They're talking about other symptoms that are occurring aside from the sinus congestion. So now her chest hurts, and she's also having some difficulty breathing. Um, and she continues to smoke. So what has she done? Think of it like this. What has she done to mitigate it? Well, she's continuing to smoke. So it doesn't look like a whole lot. And then the vital signs, look here that the vital signs were taken. So they also reviewed the patient's eyes, ear, nose, and throat, and it looks like lungs. So just make sure that you review that in the physical and exam. And then just a heads up, this is a very straightforward diagnosis. The decision making would be low, moderate, or excuse me, low, because it's very straightforward. He's not having to order any additional tests, so that should help with that one. On this scenario right here, the biggest thing is that this is a post-op bleeding. So the patient had surgery and now she's experiencing bleeding. So the first diagnosis, you're going to want to make sure it's a post-op hemorrhage because of she's having oral bleeding. So that's a hint on that one. There are secondary diagnoses, one being a specific Y code that you will use as well on this scenario because it's something that happened during surgery. So make sure that you have a Y code, but your first code will be a post-op bleeding. And then on this patient, this is actually goes up to question 9. The CPT code would be your E&M, and it doesn't say it here, but this is an established physician office visit. Just make sure that you go through and read what was done to establish the different level. Just know that this is an established office visit at the physician's office. In the last scenario, questions 10 through 13, this is also an established patient. This one is pretty straightforward, so I'm not going to go in real depth on this one, but just know this is a physician office visit and it's an established patient. So let me know if you have any questions. Thanks.